All right, let's look at the nursing care. Nursing care for cephalosporins. We need to assess for allergies to cephalosporins and penicillins. Remember that 10% allergy that we talked about previously with penicillins. We also need to evaluate their renal and liver labs, just like we did in penicillins. Monitor their vital signs and urine output. Culture and sensitivity needs to be done prior to administration. We need to look at signs and symptoms of superinfections, ingest the buttermilk and yogurt, as I mentioned in penicillins, and take the complete course. Pretty much all the nursing care that we described in penicillins is the same indicative for cephalosporins. So now let's look at the outlanders. What stands out in this group of cephalosporins? Well, let's look at cefazolin sodium, which is Ancef. That is very good in the perioperative prophylaxis against infection once we go into surgery. And Keflex, we've all heard of, has been used for urinary tract infections and skin infections. Cefoxtin sodium. Okay, so cefdinir is also called Omnicef. That has been found pretty good to treat MRSA patients. Ceftriaxone, which is also Rocephin, and y'all remember I talked about this previously. It is a broad spectrum antibiotic that we typically give before we get the culture and sensitivity reports back. So it's a good broad spectrum just to prescribe to anybody with an infection. And it's also used in good post-op prophylaxis. All right, so now you've kind of gotten the penicillin, the cephalosporins, the umbrella issue here. So penicillins end in cillin, cephalosporins begin in ceph. You list out the drugs, you find the common uses for the group, the common side effects, the nursing care for the group, and then what stands out that's different with certain drugs. All right, we're going to progress on. We're going to go on, I think the next slide will be tetracyclines. And then after that, I'm going to kind of leave that up to you to be able to pull out the things that are important, and we'll talk about those. Okay, tetracyclines were actually the first broad-spectrum antibiotics effective against both positives and negative bacteria, as well as the mycobacterium, the rickets, the spirochetes, and what have you. It is bacteriostatic in action. However, in large doses, it can have a bactericidal effect. Tetracyclines is your large umbrella, okay, or glycyclines. So tetracyclines, I want you to make as your umbrella. What is common within the tetracyclines is that it ends in cline or cycline, C-L-I-N-E or C-Y-C-L-I-N-E. So what are the drugs within this category? You have tetracycline, dimethylcycline, doxycycline, and tigecycline. Okay, that's what I want you to put into this category. Okay, so what are the common uses for tetracyclines? We find it's used for sexually transmitted diseases is a common one. Acne is another common use, as well as bronchitis, Rocky Mountain, and rickets. I want you to underline the STDs and acne because they're the two most common uses for tetracyclines. What are the side effects that we find in common with tetracyclines? And that's going to be photosensitivity. They can get burns if they're out in the sun, that kind of thing. They can also get headaches, nausea, vomiting, diarrhea, as well as allergic reactions. Nursing care that occurs with tetracyclines would be not to take by pregnant women because it has a teratogenic effect on the baby during the first trimester. Staining of the teeth is another common finding here. We find that it's contraindicated in kids less than 8 due to staining of the teeth. We need to get lab values, renal and liver again, vital signs, urinary output. Considerations is to let our patients know that dairy, antacids, iron, calcium, and magnesium, they should not be taken with this. They need to store their medications away from light and heat because it can actually increase the toxicity effect of it. Out of date. If their medicine is out of date, they need to discard it because it will have more of a toxic effect on the patient. And if they're on tetracyclines, as with most antibiotics, we always tell our patients to have a backup method of contraception. So I'm telling you that with tetracyclines. However, it's mainly with most all of our antibiotics, but very much so with our tetracyclines as well. All right, so now we found the common uses, common side effects in the nursing care, what stands out. And it's very simple. Tetracyclines, yellow teeth, doxycycline, burning at the IV site, and Tigacil or tigacycline is used for the treatment of MRSA. So there are outlanders. Okay, we're going to talk about aminoglycosides, which inhibit protein synthesis, bacteriostatic effect. They're used for the most serious infections, and they're mostly gram negatives. Okay, so the most serious, that's what I want you to pull out of the aminoglycosides, most serious infections. So aminoglycosides, if you look through your little drugs, what stands out in the name? And this is going to be tricky because we have some drugs that end in mycin, M-Y-C-I-N, and some that end in micin, M-I-C-I-N. So I want you to be able to differentiate those by looking at the generic name. So aminoglycosides typically end in M-I-C-I-N in the generic name. But if you look at the trade, it's got the M-Y-C-I-N. So I want you to focus on the generic. So the two drugs in that category that I've got for you is gentamicin and atilmicin. Okay, so they are aminoglycosides. They're the big dogs, okay? They're the ones that treat the bad bugs for the serious infections, and they're bad on the kidneys, and they're bad on the ears. So I want you to think of the bad boys, okay? Bad boys, bad boys. Gentamicin and atilmicin, they treat the bad bugs, the serious infections. They're bad on the kidneys, and they're bad on the ears, okay? So that's what I want you to pull out of that. The common uses is GI, respiratory, urinary, bone, and skin. Common side effects, nausea, vomiting, allergic reaction, nephrotoxic, ototoxic, underline, nephrotoxic, ototoxic. Bad to the kidneys, bad to the ears. Photosensitive as well. All right, again, the nursing care for the aminoglycosides, vital signs, urinary output, labs, renal, liver. The one that's most important here in this lab is renal as opposed to liver because of the toxicity. Potassium and mag levels need to be evaluated because they may decrease with these drugs. Culture and sensitivity should always be obtained first before starting your antibiotics. We need to check our patients for hearing loss. These drugs are serious drugs, bad. Okay, since they're so bad, we need to evaluate the peak and trough. So these drugs are so strong for the serious infections, we need to monitor our peak and trough as well on these, and sunblock is advised. So what stands out between these? Gentamicin is used for sometimes for MRSA, and atilmicin is good for the treatment of sepsis and peritonitis, which is a serious infection. Okay, I've taken you through a couple of classes of medications. All right, for your assignment, you need to pull out the differences and likenesses with the three remaining drug groups, which are your macrolide, lincosamides, ketolides as one group. We call them the mycin group, M-Y-C-I-N. Okay, and then you're going to go on to your fluoroquinolone group, which usually has fluoxetine at the end, and then your sulfonamides, which actually have sulfa at the beginning. You will identify the drugs in the category, the outlanders, the common uses, common side effects, and the nursing care for each of these groups. Okay, I called them umbrellas or classes. You will dig from all the written information that I already uploaded in your folder on Blackboard. This assignment needs to be completed so that you can have it for class next week. And I will upload a question answer session that you can complete for acknowledging that you were present in this online class in order to get class time for it.